My name's Donna Doyle. I'm the CEO at Boort District Health. I've been in my role for a bit over 6 months. I've been with the organisation for about 7 years. I was previously the Director of Clinical Services here. Boort District Health is a small rural health service situated in north central Victoria in the Shire of Loddon. We service a small community directly in our township of about 800 people, but a wider community of up to a couple of thousand. Boort District Health's main service delivery areas are: we have a 7-bed acute facility for acute patients. We have a 25-bed aged care facility for high and low care aged care residents. We have an urgent care centre that's open 24 hours a day, 7 days a week, and it is not staffed individually. Our nursing staff who work in acute cover that. And we have a doctor on call. We have a GP who lives in Boort, and he provides on-call and VMO, visiting medical officer services, to the hospital. So he provides our response to urgent care presentations. We also run an awesome community-based program. We have district nursing program 5 days a week, sending qualified nurses out into the community to provide home-based care and support. And we run an adult day centre program that's run across 5 days of the week also. Part of that program is in-house activities like luncheons and talk and tucker groups, for example, where groups of people come in for a meal and a get-together. We do strengthening exercise programs and cardiac rehabilitation with our allied health assistants. And part of that program coordinates our volunteers. We have an awesome base of about 40 or 50 volunteers who work for Boort District Health and with us to just provide that little bit of extra support to our community and clients. Part of that program is an awesome transport-based program. So we provide free transport for medical and like services. So we take people from their home to the doctors for their appointments, or we transport them out of town to places like Bendigo or Kerrang for scans or tests or to see specialists. We feel pretty proud about what we do here, looking after our community and our clients and consumers. Definitely the biggest thing that we face here, and it's we're certainly not alone, is workforce issues. And recruiting health professionals to the region, things like GPs to the region, something that's not unique to Boort on its own. All our neighbouring facilities and the other small rural health services feel the same. We live a long distance from anywhere. There's no public transport in Boort. So, things that people take for granted in a metropolitan setting just doesn't exist here. But what we do have is a great work-life balance and an awesome lifestyle here that doesn't exist in, built-up areas. Yeah, look, working with aged care people, it's just the most rewarding thing that I've ever done in my life. I've had a long history working in aged care over my nursing career before I became the CEO here. And I think the most positive trait that anyone can have is the willingness to have a conversation and to sit with someone who's needing care or support with basic things that we all take for granted. Walking around, having a meal, getting up in the morning and having a shower and dressing yourself becomes a challenge for some people as they age. And honestly, it's our privilege to be able to support people to do that when they get to that stage of their life. So we feel like we're in a really unique position where at Boort District Health, our local people can age in their own community, come and spend the last leg of their journey in the town that they've lived in all their life, and be cared for by people who have a real passion to make sure that they're okay. So communication is probably the biggest key. It's not hard. It's easy to find a common ground with everyone that you meet, something to chat about, and just seeing what it does to residents when you give them that time and show a bit of interest in them is really rewarding. I would tell them that the rewards far outweigh the challenges. You know, every day you come to work and you come with an idea in your mind about what your day is going to be like, and usually your day ends up nothing like that. And even in a small place like Boort, you know, we don't have a lot of challenging, complicated, complex patients coming through our door, but every day it's something different. So, you know, come in with an open mind and a willingness to, you know, give 110%, and you're going to go home happy and satisfied that you're making a difference in someone else's life. So before I came to Boort, I was involved in the concept of salary packaging in other places that I've worked, where, you know, it's part of your onboarding where you fill in these forms. You've got a mortgage, if you've got expenses, you know, it's a tax benefit to you, and you just sort of did it. When I came to Boort, there wasn't much selling of why people should want to be involved in a salary packaging program. And what we found when we engaged with Easyway was that there's just a whole world of opportunities out there that most of us didn't know existed. And the staff that we met made it so easy to understand why you would want to take the time to sign on board and reap those benefits. It's, you know, some people just go, oh, I haven't quite got my head around that or how it all works, so I'll put it in the too hard basket. And the thing that Easyway did was they made it easy. They made it really, really easy. No one had to think too hard or, you know, step outside their comfort zone or think that they're not going to understand what's happening to their wage. It was brought down to very simple terms. The benefits were explained very clearly, and I couldn't praise it greatly enough. You know, just keep building on what you guys are doing so wonderfully already. The communication is absolutely incredible and first up, gold class. It's something that we didn't have with our previous provider. Communication was difficult. You know, you might shoot an email off and not get a response for days, or you request someone to contact you and you wouldn't hear anything, and then a week later you're thinking, do I need to follow this up, or does someone else? That doesn't exist with Easyway. You send an email and you get a response almost straight away, or you know, within the day. And then what's been really enlightening for me is that you know, Easyway staff will then pick up the phone and ring you to say, did you understand what I meant in that email? Or I just wanted to touch base with you that you received that information. I would just say it's a pleasure partnering with you guys. Like I said, the process has been made so simple. Nothing's a problem, no question seems too silly or too dumb, and in the reality of healthcare settings, Boort District Health is very small fry. We're a tiny little community, tiny little service, not a lot of staff, but Easyway makes us feel like, you know, our issues and concerns and our business to you is just as important as the bigger tertiary hospitals and the people that have hundreds and hundreds of employees or thousands that jump on board this process. It's just been an easy and pleasurable process.